Hello, and welcome to RRI Explained, a ResBios podcast. It is the aim of the ResBios project to embed responsible research and innovation, or RRI, into 4 universities across Europe, in the hope of improving the interconnectivity between science research and society, with a particular focus on the biosciences. But what is RRI exactly? Well, hopefully we can find out together.
Today we are joined by Vasiliki Kiparoglou, who is the Chief Operating Officer at the National Institute for Health Research at Oxford Biomedical Research Centre, who works very closely with hospital and healthcare, but also a lot with RRI, with a particular focus with gender equality. Thank you for joining us today.
Thanks for having me here today.
So could I just get you to give a quick introduction to your background, the work that you do with the NIHR, and how the work that you've done with RRI in the past?
Yes, of course. As I said, I'm currently the Chief Operating Officer at the NIHR Oxford Biomedical Research Centre. The abbreviation of the Biomedical Research Centre is BRC, so I'm going to be calling it BRC from now on. There are 20 BRCs in the country, and the mission and vision of each BRC is to promote and support translational research from the laboratory bench all the way through to the patient bedside. So we are currently supporting 20 different themes, 20 different, if you like, research areas. We provide funding. The funding comes directly from the Department of Health and Social Care. And as I said earlier on, the main mission and vision is to focus on the patient health, the well-being, and also the economic impact. My everyday role involves very much the operations, the reporting, looking at various projects, managing a relatively large team, focusing on training and education, on business development, on health economics, and so on. With regards to the RRI, this is a project I have started working on RRI, if you like, several years ago. I find this area fascinating, extremely important. Where I work, we promote and support female researchers, doctors, consultants, scientists, and so on. Obviously, we are looking at merit and not at gender, but gender is also very important. And this is not coming from us, this is coming from our funder. So we really need to look at equality, diversity, and inclusivity in broader terms.
No, that's really interesting. And as you said, you work quite closely with a lot of RRI projects. You've previously worked with the StarBios project, which was a bit of a precursor to the ResBios project, which I'm currently working on. But you're also working with Step Change as well. And yeah, quite a lot of the work that you've done with these EU projects has focused on the gender and equality aspects of RRI. Just from my own research, it seems that like UNESCO reports have suggested that less than 30% of researchers worldwide are women. And the research that you did with the StarBios project shows that even though your research with the StarBios project has suggested that student levels, the distribution between gender is fairly equal, but then later on for researchers in later career, people within the biomedical sciences, this seems to fall down quite drastically. I'm just wondering what disparities in gender at this level has upon the research ecosystem.
The impact on female early career researchers continuing with these careers is significant, as there is lack of representation. We need to hear from a diverse group. And it's not that the more the merrier, but it's the diversity of the opinions that is extremely important. We know from research, diversity improves organizational performance. Also, research by the European Union highlights that lack of gender diversity, and in particular at board level, and we really know that there is huge lack of diversity at board level might lead to groupthink, which might in turn affect company performance, and also for researchers identifying new areas of research might be affected by the lack of diversity. So the higher, if you like, the diversity, the broader the ideas, the different voices, the diverse opinions. So I think these two go very well together.
Mm-hmm. So what are the current roadblocks that sort of get in the way of female researchers and the upper levels of management within research? What gets in their way? Why is there this big kind of drop in female participants within these higher level kind of career researching positions? And what work has been done by the NIHR to try and rectify these issues?
There are roadblocks. That's why we are here today and we are having this conversation. Otherwise, we wouldn't be here. There are roadblocks. There are some sort of borders, if you like. And I would probably highlight few. The lack of role models. We really need senior role models in order to stimulate, inspire us. Lack of mentoring and coaching. I think mentoring and coaching, and especially mentoring and coaching by senior role models, is extremely important. Potential discrimination and bias are also underlying factors contributing to the lack of women at senior level in research, medicine, and so on. And this is often referred to as a leaky pipeline. Now, what we are doing at NIHR, the NIHR is focusing a lot on EDI. We are taking EDI very seriously and has developed a new strategy on EDI. Also, we are doing this at the Oxford BRC and focus a lot on EDI training and education and inclusive leadership for our teams. I think aspects of EDI can be addressed via mentoring, and we believe that this is the direction of travel: mentoring, training, inclusive leadership, and so on. Also, we have run a number of impactful studies to help identify the evidence base for diversity, for example, authorship, and surveyed our affiliates to find out their views. So we're quite active and, if you like, proactive and trying to address and tackle some of the roadblocks as much as we can.
Just so any listeners who are a bit unsure, EDI, how would you define EDI?
Equality, diversity, and inclusivity.
Okay, that's great. Thank you. That's really interesting because of the kind of some of my background reading into the work that your organization has done. One of the papers that I've read was a survey about key aspects of signifiers to kind of denote key achievements and how the gender equality kind of aspect of that, and that more male authors get cited or there are more male authors than female authors being published in kind of academic papers. I'm just wondering, could you describe a little bit more what other key aspects that we could kind of look into for signifying career progression rather than kind of this kind of blunt tool that's used currently, which is just sort of authorship?
Yes, we identified two distinct dimensions to monitoring gender equity: organizational markers and also individual markers. The findings were based on an online survey in which hundreds of people affiliated with NIHR Oxford BRC, senior leaders, clinicians, non-clinical researchers, trainees, administrative staff, and other professionals were invited to rank the importance of 13 different markers of gender equity. Organizational markers include leadership development, senior leadership roles, staff recruitment and retention, and organizational policies and targets, whereas individual markers comprise external research funding, publications, intellectual property, and collaboration with industry. The evidence base for monitoring gender equity is underdeveloped. We believe we have made an important advancement in achieving the aims of this study: to develop a survey tool which capture the major dimensions of gender equity, and so to inform future planning and monitoring of gender equity in the biomedical research setting.
So kind of a follow-up to this, just because in my reading, I've come across the idea of kind of the invisible or housekeeping tasks that female academics are more likely to be tasked with, which obviously takes away their time from potential research activities. So this is more administrative roles, services, citizenship tasks, and the like. Do you think this has an impact on the amount of academic attainment female researchers could do? And yeah, do we need more? We need different benchmarks to kind of denote kind of academic achievement, perhaps?
Very good question. Thank you. This is about negotiation and reward mechanisms, which don't typically reward such activities. The good thing is that we are just about to publish a paper which highlights how this work is not typically rewarded in terms of promotion. So performance indicators would need that somehow to change to take this into account. Mm-hmm. Obviously, the impact, it's very hard to describe the impact that this has on female researchers' workload and academic attainment, but I think one can imagine what sort of impact will have on female researchers and their academic attainment.
So over the last, let's say, decade or so, kind of women in STEM, and as you said before, the leaky pipeline has become kind of a hot button issue. It's been kind of very well publicized and talked about, but actual proactive change has been relatively slow. I don't know if you would maybe agree with that statement, but I'm just wondering how this increased awareness can be kind of translated into change of policy and practice, and yeah, some of the proactive practices that could be done to initialize these changes, I suppose.
I think we have come a long way. It's really great to see so many projects being supported by the European Union on RRI, the STEP change, the StarBios previously. Also very important to see that the NIHR and the Department of Health and Social Care focus a lot on EDI. So I want to say that we have come a long way so far, but there is more that can be done. So what we are doing in our center, if you like, in our premises, we have run a number of studies to build evidence, and you can read more about this on our website. Obviously, more can be done regarding training and education and linking research funding and performance in order to demonstrate diversity. And I think this is a suggestion that we will probably implement at some point in future. Senior leaders are there to drive change, and they can drive change, and again, link this change to performance indicators and career progression.
Reading through some of the papers that your organization has put out over the last few years, a few of them mention quite a close relationship with the organization Athena Swan. And I'm just wondering what your thoughts are on the importance of having these kind of external moderators that are there to kind of facilitate change rather than kind of having it strictly internally, perhaps.
We all agree that the external moderation of institutional action is extremely important. And linking change to funding drives changes across the organization, and this is extremely important. But as we have shown in our research, they were not designed for BRCs. And so more specific measures are required, at least for the BRCs.
Could you maybe slightly elaborate on what you mean?
I think focusing on EDI is a good step forward. In our BRC, and this is coming from our funder, the NIHR, we are not anymore taking Athena Swan into consideration, and we have started to focus on EDI, which perhaps the indicators are a bit more broader. We have yet to see the strategy, but as I said earlier on, we have also drafted our own strategy to take the EDI into consideration. So yes, more specific measures. We yet to implement some changes, and let's see how this goes.
Mm-hmm. I suppose this next question, it's slightly on a different topic, but links back to why female representation is so important in research. There's been quite a lot of studies of late talking about kind of the lack of female representation in biomedical testing and yeah, the impact that has on female health, whereas talking about kind of drugs that side effects of drugs or biomedical innovations that aren't designed for women. I'm just wondering, do you think the inclusion of more women in more higher level research careers could help shine a light on this data gap and perhaps start kind of plugging in information that about half the population that we just don't seem to have that much information of, kind of in a biomedical sense?
In broader terms, I would like to answer this question, yes. Although I would say not just women, it should be extended to diverse and inclusive teams. I would always like to focus on merit, and I would like to focus on diversity, equality, and inclusivity. So I think yes, but diversity and inclusivity are also very important.
So I suppose just having kind of a diverse kind of group of people conducting these experiments, designing these experiments, will make kind of the experimental design just more robust and develop just more inclusive research into kind of the impacts of these innovations, I suppose.
That's right. And I would also like to add, Chris, here that it's important also to involve patients when you design these experiments, and especially patients from underrepresented communities. This is something that we take very seriously in our center. We are working very closely with patients and patient groups. A patient representative sits in our steering committee boards, and we have also formed a group of patients from underrepresented communities. I think I wanted to add that the presence of patient is also very important when designing these experiments.
No, that's really interesting just because it links back to a conversation I had a little while ago with some representatives from CHERIS, the RRI biomedical and RRI project that focuses on patient outreach within remote areas in Italy. And it's just like, yeah, that kind of link between public engagement and citizen science, perhaps that needs to be broadened out into, taken out of these little silos that, yeah, these projects that just kind of focus on RRI and kind of embraced more within the wider kind of biomedical research field, I suppose.
That's right. Again, it's diversity of voices, opinions, experiences, expertise.
Mm-hmm. And kind of linking to that a little bit, just as you mentioned before, you've worked on a number of EU projects that have had kind of a variety of focus. So obviously, we've mentioned StarBios before, and you are on the advisory board for the ResBios project, but you also work quite closely with a project called Step Change. And I'm just wondering if you could describe the importance of these wider projects within the EU and the wider scope, how these international efforts affect kind of institutional change, I suppose.
I think StarBios was the catalyst, if I might say. StarBios catalyzed further research on gender equity, and we now have a body of evidence with a number of publications, presentations we have given, models, if you like, surveys, tools we have designed, which we can apply to make changes relevant to our organization. Now with the Step Change, I think we are a little bit more hands-on, and we are involving patients when designing the protocols, the medical study protocols, and so on. So in a way, we are operationalizing what we've learned from the StarBios and the ResBios. We put it into practice, and I think this is great.
Mm-hmm. And I suppose having these sort of networks just allows for easier data knowledge exchange, even outside of the key kind of consortium, which was StarBios, ResBios. It just sort of, you develop, stakeholder network is not the word I'm looking for, but you develop kind of connections, a community, exactly, yes. And this knowledge exchange kind of goes beyond the project scope, and there's just more of a synergy between other research institutes around Europe. Just wondering if you would agree or not.
Completely, I agree. I think we have formed this community. We learn from each other. We share good practice, expertise. We help each other. And I think that's what we need. We need this sort of community, and it would be great to develop a couple of tools, if you like, that other centers can also use. And perhaps this is the direction of travel. I don't know. I can't comment on this. But having the community, having the expertise is extremely important.
What do you hope that this work achieves sorry, this is going to be kind of a job interview question. In the next 5-10 years, what do you hope that these sort of actions achieve, do you think? What would be your ideal 5-year plan for this, do you think?
I think I would like us to focus a lot on EDI, and this takes into consideration gender, but also inclusivity and diversity. I would like us to develop a couple of tools, as I said earlier on, or models where other centers can use. Obviously, in our step change project, we are collaborating only with a number of centers in Europe. There are so many others that can benefit from the work that we are doing. It would be nice to see this being operationalized. Can't pronounce the word very well, but it would be nice to see the work that we are doing put into practice. Mm-hmm. That's what I would like to see. 2 things: EDI, more awareness around EDI, and a tool model that we can use when across Europe, if you like, when it comes to RRI.
And I suppose just as soon as 1 or 2 biomedical research institutes start taking this up, it kind of snowballs a little bit, and it kind of becomes more when the practices seem to be working and the positive changes are visualized, perhaps not the best word, but yeah, the impacts of it become more visible. It kind of starts snowballing and it becomes a critical mass kind of, and then other research institutes kind of follow suit, I suppose.
Yes, I think it's very important to share the knowledge that you have acquired through hard work, through networks, collaborations, the spend of funding, public funding. I think it's important to share it and use it appropriately, effectively, and efficiently.
I suppose that links back to the other kind of keys of RRI, I suppose, with public engagement, with open access, with education, and just, I suppose within this context, that's more just, again, providing role models, maybe doing more outreach to kind of young people about the possibilities that, yeah, it might seem that these were once kind of ivory towers, kind of a very kind of certain type of person that works within these fields. But yeah, just demonstrating that there are kind of different approaches to doing this research and the people who do this research, I suppose.
That's right. And I think you used the right word. I think it's very important that the next generations or the younger generations of scientists and researchers are aware of all these issues, and they have seen some sort of developments over time. And I think it's an opportunity for them to learn from us and for us to provide them with the right foundation, so that they can build upon the foundation and develop, reach, and achieve different and new things.
I just want to give you this opportunity now to, if you had anything additional you wanted to say, any work that the NIHR is doing, or I don't know, if you wanted to talk a bit more about the Step Change project or any events that are coming up, I just wanted to give you an opportunity just to share anything you wanted to with our audience.
Thank you, Chris. I think we haven't really touched on the word innovation. I think innovation is key of what we are trying to do, not only in Oxford at the Biomedical Research Center, but I think also at the Step Change project. And we should not lose sight of innovation. What we are trying to achieve has to be innovative and should last over the years, and also should be used to create something better and bigger. That's what I wanted to add. Thank you.
And I suppose that kind of links back to the sustainability of these ideals, really kind of beyond StarBios. There was ResBios, but ResBios is ending in December. So yeah, kind of with these innovations comes tools to help with sustainability, I suppose, just sort of driving these issues forward.
Perfect. I agree. Mm-hmm. That's right. Yeah.
That's all from me. So thank you very much for joining us today.
Thank you very much for inviting me. I really enjoyed the interview. Thank you.
Thank you very much.
The ResBios project is funded by the EU with the grant number 872146. To learn more about the ResBios project and the other pillars of RRI, please go to resbios.eu. Thank you for joining us. See you next time.